Chapter 5, we will discuss the fundamental of the revenue cycle, the facilitate facility demands of money coming into the practice, and the most important efficient types of accounts receivable that are insurance versus patient payments. Therefore, it is vital for the proactive and collecting payments from both parties and must be successful. This chapter includes reviewing the elements, the foundation that comprises the revenue cycle as it pertains to the collection and collectivity of fees that facilitate and facility. The objective of completion of this chapter, I believe students should be able to identify these elements recycling into the revenue cycle. Review the elements, review the cycle process, apply the element in reviewing those process in the revenue towards the outpatient versus the inpatient environment. Understanding the relationship of revenue cycle to those expenses, for example. These are very important in revenue cycle. Revenue components, as you see the fundamentals in the revenue outline and objective. The activity that starts with a new patient needing and making those appointments, needing those appropriate in those healthcare facility. Who competes, who completes, who registering those forms. The patient receives a service, a documentation upon walking in a medical center, upon those medical record. These services, along with diagnostic and diagnostic, or for justifying the need for the service, are also documented. The need of documented the procedure or service and the diagnostic procedure are covenant, converted into the codes in some medical center from insurance form completed to these codes and sent to the patient insurance carrier for what they call reimbursement. The insurance company process the claim and sends it to send it for payment. The payment is then recorded on a patient ledger, on a daily log, a daily sheet. The explanation of benefit, the EOB, is examined for correctness, denial, for money owed. The patient may be responsible for the co-payment, for example, for the uncovered services that will be billed. The patient will visit when the patient visits and see a healthcare facility or a healthcare provider, he or she will seek the services in those healthcare certain environment. A patient may seek services in a variety of setting those environments depending on the nature of her or he or she medical condition. These environment settings includes are not only limited to the physician office, a specialist radiology, for example, center, a laboratory, or long-term stay care, hospital inpatient serving, in which the patients are admitted, and hospital outpatient, where patients are not only admitted to seek treatment, to seek help, and leave the same day. When a patient arrives at a healthcare facility environment, a new patient information is obtained by medical personnel, such as the receptionist, as discussed in chapter 1. The recalls those information includes the reason of those appointments, for example, for insurance information, the billing information upon arrival of those patient in the facility. All patients have to go through a registration process to be sure that information is not only there but accurate. Patients who are there for the first time are considered new patients, and the full registration is needed for those patients to be completed prior to the patient seeing a return for a patient or seeing a doctor that considers an establishment that require paperwork. Demographic be reviewed, updated prior to this follow-up, for example. Visit obtaining accurate information from both types of patient versus the pertinent to the billing process, because this is the first step to beginning the claim, beginning the claim form, and completion and obtaining those revenue in those hospital environment. Avoid errors with patient registration, else they might be transferred from another hospital to claim for a claim form, and then be claimed that could be denied, may not be copied or scanned, duplicated. So it's very important as a whole part do electronic procedure, have an electronic right sign, third party. All these are suppressors in the process of patient receivable needs to be covered. The patient needs an appointment and seeks the services in the healthcare division or environment. The registration form is completed. The patient receives services and also diagnostic services, and these documented all need to be not only documented in the patient chart. Service and diagnostic are covered to those codes must match. The claim form is completed and sent to those insurance, for example, after and during the service. The claim is processed and also the payments are sent afterwards. The payment can be recorded on the patient ledger and it can be daily recorded or daily file or daily monthly file. Insurance and billing information are very also important in the process of receivable payment of the patient. As discussed in Unit 1, the reason for the appointment was determined when the patient is called to make an appointment. Think about that. The completed patient registration form gives accurate information of the insurance company to be billed, for example. The information includes who the patient is, who the subscriber of the insurance is, who has the policy, identification of that policy number, the patient employee versus the patient has a policy with sometime with a second insurance company. Copies of all insurance cards and all these files must be filed. These cards have importances in addressing the telephone number as well as amount of the copay. It is if a referral is needed when registering a patient within the telephone call. They need to request the patient to use the insurance card to give the information for the registration. The receptionist should know about insurance billing. The receptionist should know about the procedure, knowing the information is needed from the time the insurance card is given. All the insurance cards are different in many cases. Identifying what company, identification of that number, identifying which insurance address is very important to the registration process, because that's exactly what the billing department is going to use. A trained staff will be able to guide a patient throughout even a telephone call, obtaining accurate information, ensuring that the registration is accurate, ensuring that the process is accurate. Patients who already have billing information in the system will be the same process. There's nothing different. It should follow the the very information that's already been accurate. Request that the patient view his or her insurance card just to make sure it is his or her insurance. Appropriate information, make correction. All these registration processes or screening process procedure for a new established patient. It's also important to obtain accuracy of those information insurance, because insurance company pays the claim. Although the process may be different, the end result is always creating information to start the claim form. This process pays an importance in the role of obtaining the money from the insurance. As a result, the claim and also the payment may be received as little as 2 weeks. Importance of billing. The book talks about the service performed and documentation process. As you write this down, service can take place in many recording different healthcare settings, including the physician setting, physician office, radiology center, laboratory center. I repeated this because I repeated this in my opening. Hospital, long-term care, adult setting. Figure 5.1 in your book, figure 5.1 in your book, depending on the circumstance of the station, may need to order referral to go to a different location. Whether the location of service are provided or not provided, they're all parts of the revenue cycle. The revenue must follow the protocol of billing and coding properly. After a patient have received services in healthcare industry environment, each of the facility is responsible for documentation of the service provided. medical billing and coding profession believe if that service aren't documented, then it didn't happen. This is another process revenue cycle that you want to write down, use in your discussion, in which a patient is documented, allows the billing and the coding department to determine the fee sent for payment. Therefore, without accuracy or document service or procedure service, the facility will not be reimbursed. It means you're not getting paid. The physician office, the patient receives service in the physician office. And when the patients are in need of the treatment, when they will call the physician office first to get the further direction. These are all very, very well important. The physician can be primary care provider or a specialist provider, which the patient referring has referring form from the primary physician. In addition to the office visit, some patients will also receive procedures such as EKG, immunization. If the patient contact the office, your staff must be determined whether the patient is going to be able to receive the treatment. Should be where you should to be focused if the treatment is not available in those cases, where to send those patients, where who or she will be contacting them for those needs of those appointments. With no further ado, after the first patient appointment, you may send him or her also to another physician due to a second opinion. For example, it is called a further workup in a scheduling appointment. Your staff should always be prepared to answer questions, to question the patient, also to question the patient about his or her health and condition, determine his or her need for the visit. Elsewhere service performed based on the facility recommendation. For example, figure 5.2 shows an example of specialty common procedure in addition to those diagnostic tests to help find and confirm, to monitor the patient needs and condition independent on the healthcare symptom. A physician will order tests that is necessary. Patient will be presented with an appointment, a walk-in appointment, depending on the facility procedure. When presented for a test or testing, the patient needs to be prepared with orders, insurance, information. All these are repeated before medical history. For the registering within those facility staff. Facility that perform diagnostic testing includes that are not limited to radiology, not limited to laboratory, hospitals, outpatient clinic, for example. All these are very, very well important. And assigning codes for the billing. Codes assignments is very, very important. It's very, very important to the aspect of revenue cycle. The process of code assignments includes diagnostic and also procedure coding to ensure the necessary medical codes. When a procedure or service is performed, the ordering of provider must justify the medical necessity in order. The provider cannot order anything that is not warranted for the patient diagnostic or treatment. The method of justifying a medical necessity is linking the diagnostic to the procedure on the claim form. For example, the EKG can be done for someone with a chest pain, but not for someone with an headache or something like that, or ear headache. Justify the needs for the EKG, however, may be justified in serum and a removal. This is just one example of many that outlines the medical necessity that relates to coding of a patient. In each case, the patient has a specific need. A specific provider must identify the need through the patient interview. Write that down. The exam as he or she conducts the medical exam of the patient. As a result, exam of all procedure or services defined and must be identified by the provider too and the physician. But the provider must identify the demonstration of the necessity of the medical process, the patient history, and the provider examines the staff documents, starting from that reception took the information obtained during the medical encounter and extremely very, very, very important in justifying the medical necessity of the coder. While documentation can be added anytime during the process of visit or even afterwards, it should be documented as early as possible to be sure that the data and information is accurate. In addition, through those documentation is vital, important to process codes, to read the codes, the documentation and accuracy joint together all procedure of services that were performed, maximizing reimbursement issues. During the code assignments, you must all know the procedure of services that were done, why, which must be apparent through the documentation in these patient medical history record. In some instances, for example, the documentation of may be missing. Despite the direction of the code, the procedure, and also the services, coders will be responsible for identifying, responsible for discrepancies, addressing those appropriation, addressing accordingly to all guidelines. With these missing or not missing or incorrect missing information, the coder may not be able to include the procedure, include a service, include a claim for submission, resulting in a lost revenue cycle. In the end, the documentation is vital for medical facility. The following section in your books identify the processes, the process of assignment, the process of codes, the process of procedure, diagnostic procedure, the process of, however, not all scenarios describe procedures. Not all scenarios describe services that are provided by a physician, the ambulatory, the surgical center, the hospital, the observation laboratory, the physician therapy, the urgent care. What's another one? The hospital outpatient center. Oh, let me go on. Are assigned a CPT code. The CPT is called the current procedure terminology. Level 1 coding, the system that was developed by the AMA. You know what the AM stands for, the American Medical Association. Uses the 5-digit numeric number, alpha numeric number designation to identify the procedure service provided by patient. If you're looking at your figure 5.2, rather than someone writing out the description of procedures and process and services, the CPT coding system assign a description. The CPT book is numeric and alphabetical order identifier. Each coder and each bill, and she'll have one sitting on the desk in case they don't have it all memorized because now we're in a new coder won't have a description appropriated in their mind. So they have to have documentation assigned numeric and alphabetical order to understand how to identify to submit those insurance. To submit those insurance billing to the coder, to the insurance company. The codes, the copyright, the CPT, the AMA, the coding system. This is a lot of complaint with the HIPAA that issues all the medical providers, insurances, procedures, carriers, all these acceptable coding system. Along with this, the HCPCS and also the ICD diagnostic codes describe a level 11 codes that call the HCPCS, the Healthcare Common Procedure Code system that we're talking about, includes 5 digits also in characteristic of a numeric and alphanumeric representation service code. If you go on in your book, figure 5.3, it shows a similar with the CPT codes. Code book that has to describe those process. For example, the codes, breast incision for breast incision goes from 19,001 to 19,002. These catalyst breast catalyst list separated addition codes, primary codes, procedure codes using 19,001 into 19,000, I believe. These image guide the performance, the mastery of the mastotomy with those exploration of drainage absence, those 76,000 codes, injection procedure, also is a manometry, doctogram, cladogram, radiology supervision, also interprofessional system for Cadillac Reverage or mammogram, the collection of of specimens, category 3 level, code 0046T, I believe, tells the coder about the alphabetic and also the process of the characteristic of the process for the coder. Decide which codes to choose accordingly for the patient of medical and record it into the medical history. Although these characteristic and coding systems are similar, the two different code sets can be used along with those together based on the patient needs and process procedure for the service that is provided. In some cases, both codes books may have an appropriate code and the medical biller code that must decide which code is more appropriate for the use of the medical use of the patient. Description, those insurance carrier. These codes are very, very well used to build medical carriers. There are some for some private payers who for selection of those procedures. For supplies, also the codes are used as such as durable medical equipment and also injection equipment, medical medication, diagnostic, the ICD diagnostic codes. These international codes, classification of disease is a coding system used to report disease, diagnose, and also show reason of those encounters with healthcare provider service. The code sets a numeric and alphanumeric 3, 4, 4, 5 digits, as I said before, code with decimal after the third digit. So you can see in your book at figure 5.4, the ICD diagnostic code provides a description of the disease, provides a description of the illness, the signs, symptoms, reason for the encounter, reason for the medical coder must determine the appropriate use of based on the bill and based on the patient medical record. So as you write these down, the coder, the biller must obtain information that is documented that is needed by provider. Use the ICD diagnostic code book to locate the appropriate codes for the patient encountering. The ICD diagnostic code, the system fulfills the requirements of the HIPAA that mandates providers to document the report, to document the reason, to document the encounter, to document in patient history using a uniform system of code sets. These official guidelines are published by the U.S. Department of Health and Human Services in the service of conjunction for other organizations. The anticipation and implementation of the ICD 10CM and ICD 10 PCS in October 2003 to be referred to fulfill the HIPAA third-party payers to refer to what type of insurance a company whom what individual may have insurance with. The plan, the patient signs a contract with a third-party payee, a payer, pay a premium for the coverage of those medical services that is provided at a hospital. The procedure, each third-party payer has a different policy, a different coverage. The patient should know his or her policy, what it is covered under. In many circumstances, the patient are not familiar with a third-party policy. Rely on the provider office to know their coverages. For example, the staff at the facility, including the receptionist desk, including the receptionist, the clinical staff, should be familiar with the policy. Know when or to further investigate for the patient to ensure a proper procedure, a proper service are covered on this patient, and the patient does not end up unnecessary with a large sum of balance. When insurance rules are followed, most policy will cover the procedure, services deemed to those medical necessary. When a diagnostic is justified, the service and the procedure, and also the patient will be left with a co-payment deduction, the co-insurance amount. In some instances, for example, when the provider office does not verify the policy, does not verify the guideline, this can result in a lost revenue cycle to the high patient, even the high patient with a high balance. These insurance companies can justify as private commercial or government, for example, insurance companies, Medicare, Medicaid, worker insurance compensation, auto insurance, disability, Blue Cross, Blue Shield, United Healthcare. Was another one. Was another. These are all provided of the office that should be proactive in obtaining appropriate information as well as checking the policies, guidelines, procedure, coverage for the patient outcome and benefit. Ultimately the patient is responsible for knowing his or her policy. But most facility or environment would take time to recognize the policy because they are to work with them. They are to work with them every day. The information of this third party payee or payer obtained during the reception or patient registration can be confirmed by copying those insurance cards on file. These are all assured surgeon of a backup plan, a backup copy upon for a patient arrival, also for the hospital to check those information to be sure the visit, to start the insurance process, to begin to call the office, to call the registration process, to call the biller, to call the insurance company. Accuracy in those information revenue cycle are needed, must be. So process, the procedure or service can be formed a patient primary insurance or a combination of both, of the primary and the secondary. All these are all not only important in the payments process. Payments are in the form of checks, credit cards, or cash. Checks are endorsed. All these must be done at the reception desk. Facility, name, account, all these are documented within those files. To put deposit only if accepted with checks. Before accepting credit card, a patient account, or after the credit card payment has been processed, the patient will be given a slip to copy to sign. The copy should be also put in a procedure in the slip, in an account, in a receivable account, and also the patient account noted. All these are ensuring he or she has a receipt in the hospital is showing account of it. All patient payments are also recorded on the patient ledger. You can see that on your figure 5.5 on a daily log, the figure 5.6 on the sheet. That should show the balance at the end of the day, the accuracy of the balance and accuracy. Important to also understand that payment from insurance companies accompanied by remittance, the RA, explaining the benefit of the EOBs. Figure 5.7 shows the documentation that contains the service, that contains this process of the CPT code that we talked about earlier, that allows deductible co-insurance process, co-payment insurance process. They may also contain information on payments, reduced or denied. If something was not covered or paid, the appropriation is needed. It is imperative, important, examine the RA and also the EOB thoroughly to those comments, denials, the reduction, the expectation of those payments, reasonings, also the payment service. These might help also not in the form of not denied, including the service that is uncovered to be recognized. This might occur with the cosmetic procedure, for example, coming from a procedure in an emergency. The terms, contracts provided insurance, the codes will be different. In some cases, they might be the same but different procedure. So it's necessary to understand the diagnostic that does not follow a relationship of service. Providing payment may be denied just because of that. Patient not covered, but the insurance for cosmetic. The accurate information placed on those insurance form. Incurred ID number can deny a payment. If a patient is not covered, the balance must be returned to the patient. So, if you took the patient money for something you did for cosmetic and as a diagnostic within another medical field, it is denied, and you got the money to carry it. You as a facility got to make sure it's returned to the state. to the patient. So having an update carrier information, having an update or timely filing limits, especially those carriers issues, whom they what the hospital also shows on file, shows the responsibility of the hospital. All these are very, very well not only important, identify the patient, and also identify all the claims. Includes a letter explaining the situation. In some circumstances, documentation is needed to support decision to appeal or deny. As stated earlier, each carrier has a different method for appealing or denying a process of claim. The carrier must contact those directions and those if what is necessary. These methods include online appeal process, many completion of appeal forms, specific forms within those carriers. If you look at Figure 5.8, it illustrates a sample of appeal letter payments applying payments to those patient account. Extremely not only important, but very, very important. The account must be correctly credited with all payments from all insurance company, from all carrier, from all from the patient payment. This is a proper application of payment. Someone can determine what is owed by a patient, but what is denied by the insurance, and the adjustments of those contractual allowance to be contracted is very, very important. The insurance, not all insurance companies are contract with a provider. So medical bills must be cautious of applying adjustment, cautious of those accounts. In some cases, payments must be applied. No other entities or entries are made. However, most circumstances, insurance payments require posting of payments, transferring deductible, co-insurance, co-payment, posting of adjustment. All these are very, very, very well important to create appropriate balance account payments that must be applied to the appropriate claim, representative, dates, service, process, procedure, bill, amounts, accurately. Applying payments should be done with caution, not rush. In the end of the day, all payments transfer, all payments adjustment can be viewed on a sheet, can be viewed on the tab or the log. Daily log confirmation, Figure 5.5 show an example of those practical ledger. 5.6 shows an example of a daily log, also on the sheet's daily log. Even more important is determine the additional money owed to the healthcare facility or hospital. Determine if any money are due involves receiving RA or the EOB for information of payments and denials or denied. Comparing those information to the patient, which shows what services and what procedure in within those patient and fees and other payments made by the insurance, the company or the patients, reviewing those balances and also transferring those appropriation of making those guides and those euphemism of under contract, what contract, the co-payment. All very well are important. And I want to see if anybody has a question so far. 6:32. Let's see who's joined so far in chat. And no one's in chat, so you can always email me on Chapter 5, showing the new patient that completes the registration, showing the services and the procedure that is done. Chapter 5 covers services and also procedures, covers documentation. It also covers services and procedure assigned to the CPT, the HCPCS coders, diagnostic assigned to the ICD code, linking those services. All these procedures also cover the patient third party insurance, bill, and payments for the services and also procedure made by those insurance companies. The explanation of the benefits are reviewed the patient's account is credited. All these are the process in Chapter 5 that shows balance, denies rejection of claims, someone that completes a procedure, applying payments, remaining balance, for example, denying those claims that was done afterward. It has nothing to do with the original procedure. The RA or EOB will identify the process by which to assign the balances, appropriate those how to read the denials to determine the further action that is also needed for the biller or the coder. When the patient account shows a balance at the end, the payment position, the process position, the balance position either owed by someone or else denied needs to be appealed. All these addressing these situations is a handle differently in different hospitals, different scenario, may have a different approach in each field, in each hospital, in each facility. When the balance are left, the biller or the coder must determine if the patient is responsible or the insurer is responsible. When someone views the RA or the EOB, the balance will be for the patient or the insurance. So it's important to determine the reading of those deduction of the copay, deduction of the co-insurance accounts, all these not only applying credits, applying adjustments. It indicates the amount of in each column in the EOB to the patient. The column for the patient balance, the column for the hospital or facility, different column heading to depending on the insurance or the company. Sometimes the columns are added together, so the biller or the coder must be cautious in transferring the balance. Must also be clear identifying those patients to understand that he or she owes the service, owes the money. The statement from the provider sometimes not confusing those information, not being clear in identifying this information, and the balance consists of different issues. Another way is to confirm the patient balance is to try to locate the patient responsibility amount. That is something printed on the RA or the EOB, and getting to know the insurance carrier, getting to know the biller, the coder will learn to identify these balances issue that should be already infected or put on prints in the hospital. He or she who are insured should call the insurance carrier to have a direction. The insurance card can also be one of the assistance for patient balance. Thus, the card can also compare to the RA or the EOB for further clarification. Now, the cases when transferring balances to a patient, be careful, be certain they are accurate. Although denials leave the balance, they are handled differently from patient balances. Denials can have a severe or several different results, such as adjusting denials because they are not covered, transferring the denials because they are not the patient's responsibility, or applying appealing the denials needs further documentation in order to be paid. Although many denials exist, these are some of the examples I'm giving you today that a biller or a coder will have to work with when denials are not covered or part of the contract allowance, the balances that are adjusted during the payment posting process. However, these are not only important, the denial needs to be viewed carefully. Denial needs to be for any recourse that may exist. Although the denial may also appear to be an adjustment, it may be the result of inaccurate information entered during the process claim, the process of collect the prostate documentation. In this case, the denial service, the procedure can be corrected, sent back to the insurance for reimbursement. The code must be carefully scrutinized. The denials check all documentation before making any adjustment. Another reason for denials may be something not covered under the patient policy. Thus results in the patient owing the balance afterwards. Sometimes these denials can appear as they are in adjustments, and and the RA or the EOB during those period payments time was posted. The columns must be read carefully, and the balance for the denied service or procedure must be transferred to the patient. As such, cosmetic surgery, I've used this already. Another typical deny is a claim that can be appealed. And then in some instances, the insurance carriers view these services as what you think already. Procedure is not typical. Procedure is not being covered due to a policy. However, an appeal and also a written documentation, the biller, the coder can identify the need for this cosmetic. Maybe the patient got burned and needed to get the face back. After such information, insurance company would see this as a needed factor of patient service, collecting those funds and paying the revenue cycle. The medical facility insurance payments are very, very patient's position for the patient. Collecting the process must be attended, must be all time. For insurance companies, must be for the patients too that are billed directly using those claim forms, using those process of a CMS 1500 after all the CPT, the HCPCS, and the ICD diagnosticals are determined that all bills are entered onto the claim form with the patient registration information data. This is the beginning of the billing process, basically. As the insurance carrier reviews the claim form, as the insurance carrier determines the payments for the provider, the majority of those insurance carriers require a provider to submit a claim form electronically for payments. However, a few instances, for example, exist. Claims are printed, claims are mailed, the claims paper sent, such as secondary paper. The need for the primary pay for the EOB attachment with those electronic claim submissions, for example. The billing is a cleaner and a quicker. The billing is quicker and cleaner in that process. Sometimes better revenue cycle for the provider office. These are all very, very examples I'm giving you during the billing process. Balance. Sometimes left for those balances left for the patient can be negligent in paying or his or her amount due. In the effort of that facility to maintain cash flow, and collection agencies usually sometimes use to collect the money after the 3 steps, after 90 days, some cases, some office, 3 steps of trying to collect. They wait 90 days to go outside for collection services to involve beginning and collecting their own collection steps. But when hospitals use this procedure, the state does have a guideline that must follow precisely, calling the patient at appropriate times, not calling all places of appointment. Some of the requirements are very stringent, so it's very important that you write it down to show those collection regulation process and billing of collection. At all appropriate time, these members are educated and guided with lines, and also follow the accuracy of those collection process and billing process. Very, very important is compliance with regulation. You will write that down. Compliance with regulation. There are many regulations to be aware of in medical field related to revenue cycle. These include not only limited to regulation form, the OIG, the Office of Inspector General, the CMS, the Center of the Medical and Medicaid Service, the HIPAA. I mentioned that earlier, but not give you the definition. The Health Insurance Accountability Act, the Joint Commission. Many of the agencies are joint commission work together in accordance with the changes, accordance with the process of procedure, maintaining not only the procedures are created but are followed due to the consistent change of the regulation. The bill of coding needs to be educated on those basis manner, on the process manner. The process provides those necessary open line communication. We'll write that down. The office and staff provides the importance of being successful, being open, update, accuracy, all information that follows. The importance shows extreme there are some importance that affects the revenue function of the facility. There are two sides to a revenue cycle. So you want to write that income and expenses. That's easy, isn't it? We discussed the income, how the money is being collected. We discussed that when I first opened, how patients and also insurance and insurance companies, in order to maintain an effective revenue, an effective cycle, importance of the step that need to be taken to increase the income, so the expenses can be paid and covered. When collecting the information and income, all these office staff must also be in mind amount of expenses that's going on, so this way the run office can run smoothly, be successful, for the patient outcome. Mistakes can be made in a patient registration, insurance and billing. All these might have a wrong address, for example. Uh, Sometimes it can affect the amounts, because if you have an insurance card, insurer has a verified address that don't match, they will wonder what's going on. Is this somebody else appropriation or misappropriation and submitting? All these are all issues that can come up. So it's understandable the mistakes will happen, but for us to do our job in revenue cycle position to correctly and also promote a positive cash flow that shows a side of revenue, that shows a side of revenue cycle, expenses are paid, includes rent, mortgages, payroll, includes taxes to be paid for insurance, security payments, deduction for taxes, Medicare, medical for employee. All of these are a part of revenue cycle. Equipment that needs to be bought, a malpractice, some cases, physician malpractice lawsuit. All these as well go into revenue cycle to show a possible process, practitioner of a hospital, practitioner of a clinical practitioner that shows a finance of revenue that are effective, including also accountable, paying bills. These areas discussed in Chapter 6 are very, 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 very well important. The summary of Chapter 6 shows the revenue cycle and the gaining of a patient that makes an appointment. That's how I open this for you in a healthcare facility. Number 2, I'm closing the medical professional deals with first reception and entering all documentation, all symptoms, all diagnostic, all insurance card information, billing. All these are job receptionists upon a patient walking in. The service procedure performed and documented afterwards and during the process of seeing a specialist and have seen the patient, treating the patient. All these must be documented. Reception and coders and medical coders must understand the procedure of service and diagnostic. So this not only they are able to fill out the forms of the correct code, understanding the reflection of the chart, documentation process. The insurance company receives the claim form. The healthcare care facility or hospital process the claim and returns any payments to the health care facility, along with also remittance to the RA, explanation of the benefit to the EOB payments received from either the insurance company or patient. All these appropriation to the patient account is credited. Determination that are made after examining the EOB and all the insurance information, in addition to money and also dues and patient process. Incorrect payments from insurance may be prompt appeal letter. All these time must be compliance with federal state law carrier regulation. The effective application of a part is necessary in the revenue cycle. It is necessary in the finance that will ensure the ability to handle all sides of revenue cycle, revenue expenses. I want to thank you today for joining me, listening,